have a mission around improving the health of rural populations, and also working to improve outcomes in rural health workforce. And that means supporting students to come to a rural area and have a high quality educational placement here, learning clinical skills, but also understanding the joys of working in a rural area and what they can contribute to the health of the local population. So we've done a lot. We've had a lot of learning and experience now around educational delivery, and I think we've now hit upon the model that we're very interested in pursuing into the future. And that is that when students come here, we're not just replicating what they could learn in an urban metropolitan hospital. We want them to have a very different experience. We want them to be learning things, but also getting an educational experience that adds value to the local population. So many of the students now are working in an area where there is some unmet need, where local people would not be getting a service if it wasn't being delivered by those students.
Most different about doing a rural prac is the way you're treated. I find sometimes, you come from being a student and then you come rurally, and it's almost as if you're respected a lot more because you feel like you're contributing a lot more to the team, because you are needed. The work you're doing seems to be a lot more valued, and I reckon that's the best thing that I've found about being rural is you're not so much treated as a student, you're treated as a colleague, and even if it's your supervisor asking you to go for a surf after work, or that sort of thing. That was the best thing I found about working rurally, because it's just that different relationship, and it makes you become more of a professional than a student. You're not so much relying on a supervisor. You take more work on yourself, and you're more willing to sort of take risks and not be always questioning yourself and questioning supervisors to what you're doing.
The way that cultural training has been done in the past is there's a huge emphasis on historical impacts, and how those historical impacts have created generational trauma, and that generational trauma then contributes to the way that Aboriginal people act and behave today, and how they interact with the rest of society. It's a very necessary component to understand Aboriginal people as being a large portion of the client base for health professionals. When student placements do come out to the rural areas like Mount Magnet, they get to do a program which we call Understanding Yamatji. And Understanding Yamatji does it from the perspective of understanding the local people, who are the Yamatji people, and understanding the structure of Yamatji. Like Yamatji is an umbrella of the region, and underneath that umbrella you've got several groups. And like I'm an Amangu person, but when we go out to Mount Magnet, we go through Wodjiri country as well, and we'll go out to see the Badimaya people. So they're learning about the diversity of the people as they go along. But once they're immersed in Mount Magnet, they get a chance to practice clinical skills out there, and a portion of that time out there is devoted to understanding Yamatji. And in the understanding Yamatji, they learn about our culture, our society, how it operates, and they also get to experience life with the people. So they get to eat kangaroo and barley grubs. When we can, we go bush. They get to sit around a fire and stuff like it there. And on a couple of occasions, students have even come along to sing-alongs with Aboriginal people. So understanding Yamatji is a really positive experience that we hope will attract people to the lifestyle theme of rural living.